Good afternoon and welcome to yet another episode of your favorite YouTube channel, Jyotish for All. We are very fortunate to be joined by Dr. Manmohan today with us, a renowned veteran Ayurvedic doctor, and he's very popularly known as Vaidya Manmohan among his clients. In a career spanning over 3 decades as a practitioner, Dr. Manmohan has worn multiple hats, which includes the setting up of an Ayurvedic medicine manufacturing unit on a small scale, as well as heading a renowned green leaf classified Ayurvedic health resort in Kerala. Most recently, he was the chief physician at Ayurveda Gram Heritage Wellness Center in Bangalore, where in addition to providing treatment for his patients from around the world, he has also trained aspiring doctors and therapists both in India as well as in the United States. His areas of specialization include health concerns like autoimmune diseases, infectious diseases, lifestyle diseases, stress induced mental discomforts, depression, endocrine disorders, spine, and joint diseases and infertility conditions. Dr. Manmohan, thank you so much for joining us today on Jyotish for All.
Thank you so much, Ajish, for inviting me to Jyotish for All, and I'm happy to answer any questions that you might have for me.
Thank you so much, Doctor, for that. Let's try and begin with a very fundamental question on Ayurveda. You know, there is a thought process which goes that Ayurvedic treatments generally take a longer time to cure a particular illness. How far is that really true?
Yeah, from my side, I would say from an experience, as an experienced physician, it is because of the fact that many illnesses try different methods of treatment and then finally knocks the door on Ayurveda. They might have tried so many other methods, techniques of, or other different systems of treatment, and then finally none of them works, and then they finally land up in front of an Ayurvedic physician. So the thumb rule is to know, um, to bring forth the disease state to a physician at the earliest onset. We need to know when the symptom first appeared and how fast it is being attended to. Okay, so the Ayurvedic physician has to evaluate the symptoms at the earliest in order to treat it quickly. As long as we are close to our own selves, we will be very much able to perceive the signs the body is going. This is irrespective of whether it is on the physical plane or on the mental plane. Now, once we notice those minor abnormalities, however minor it may be, then as soon as we allow those things to be attended to, then the resolution is quick. Otherwise, such conditions take a longer time to be cured or healed. Now, the duty of the physician is to first note once the condition appears before him or her, whether it is curable, partially curable, or not curable at all. Once a prognosis has been made that this particular condition is curable, then the physician will be able to advise whether it can be cured through the process of conservative management or not. And therein lies the importance of knowing the body constitution of the patient.
So, doctor, is it you said it has to be detected at a very early stage in Ayurveda to compress the time of treatment. Uh,
Mm.
there are people who tell us that a good doctor can feel the patient by the pulse. So speaking about diagnosis, how does an Ayurvedic physician diagnose an illness? Is it by feeling the pulse, or do they have any further processes which gets included in diagnosing a certain disease?
There is a general concept that Ayurvedic physicians just feel the pulse and see what disease one have. I have many times I have patients landing up in my room and saying that, doctor, feel my pulse and say what disease I'm having. But pulse diagnosis is just one part of a whole plethora of physical examination the Ayurvedic physician has to instigate in order to find the true nature of the disease, the ability of the person to attend to it, to heal to it, or whatever medicines that has been prescribed, how well it can act on the patient's body or mind. like the pulse, to read the rhythm, speed, frequency, and flow of the blood. It's not only to know these parameters, but we need to also look at the eyes to examine the tongue, the teeth, the throat, the skin, the nails even. We need to ask questions pertaining to the bowel movements, the urination, the appetite, the sleeping habits, and even the sexual habits of the person. There are a lot of other factors which we need to um, find out from the patient as to whether it could help in the proper diagnosis of the disease. And it's very much important because I, during my experience with the patients, feel that the more time that you give to the patient, the more knowledge, the more information they'll be able to throw out about the illnesses they have. And this would help in delineating so many aspects of a differential diagnosis to arrive at the correct diagnosis. And modern Ayurvedic physicians, I'm quite sure, will be making use of the developments in science and technology to utilize the many apparatuses, machines, and monitors to, it's not to make a diagnosis, but rather to understand the disease better, Atish.
Understood. Understood. So, doctor, when you say the constitution of the patient, is it really the triad of the Vada, Pitta, and the Kapha? Is it something only a physician could evaluate, or is it something that everyone can evaluate on their own?
Yeah, indeed, it is the Vata, Pitta, and Kapha, the triad, what we call the three doshas. Three in Ayurveda means three, dosha means the elements, which I was speaking about when I mentioned the body constitution. Well, these three happens to be the combinations which dictate our structure, the very structure, the physical and the mental structure, and the stability and the steadiness of it, as well as the energy which is latent in us, inherent in us, its ability to make us do actions and be part of transformations, as well as the ability to create movement to do justice to such actions and transformations. These are nothing but the five basic elements, which is earth, water, air, space, and fire, and the different combinations. Of course, it is something which a physician is best adapted to do. The physician is trained to evaluate, examine, observe, examine, and evaluate the patient carefully to know which is the predominant element among the three, which is the second dominant, what is the natural state of balance uh, in a healthy individual, what is the state of imbalance in a diseased individual. The natural state of balance we call prakriti, the disease state of imbalance we call vikriti in Ayurveda. Now, to answer another part of your question is whether everyone will be able to do this. I have seen in the internet, there are so many self-evaluatory questionnaires helping people to know their doshas better. But as with searching for medicines, for treatments of diseases which one might think that he or she may be suffering from through the internet, this can often lead to make the person conclude certain things which is not correct. So it's misleading, to be, in other words. So I wouldn't suggest a person to make an assumption of one's own body constitution just by going through a questionnaire oneself, but to be with an Ayurvedic physician so that he or she will be able to observe and evaluate better.
Understood. Understood. So it's very interesting, doctor. No, air, space, fire, earth, and water coming in together in a human body. It's very enlightening for me as well, personally, at a personal level. So with that, let's move into the next one. So is it true that the Panchakarma is a necessity for every patient, and how often does one have to undergo the same?
Well, Panchakarma happens to be one of the um, most misunderstood terms. There are many others as well in Ayurveda. And I would say that there are patients who walk in and say that I underwent a Panchakarma for 2 days by going to a center and had a couple of massages, which is uh, very ridiculous when for a person who knows what Panchakarma is. Panchakarma is a very comprehensive treatment program which is purely residential. It is strictly residential. One has to undergo this, staying at a particular center, offering this for 14 to 28 days, depending upon what concerns you happen to have, and then undergo the procedure. It is uh, a complete uh, detoxing treatment of the body, because in the course of our lives we knowingly and unknowingly accumulate a lot of toxins in the form of preservatives, additives, coloring agents, emulsifiers, etc., through the food we eat, the kind of energy levels which we happen to accrue from spaces which is uh, not good for us or detrimental to our health, and from people also. All of us do have energy levels around us, and when we happen to go through these kind of things uh, unintentionally, we tend to accumulate a lot of toxins which need to be cleansed periodically. So even for a healthy person, it is good to undergo a panchakarma once every year, irrespective of gender, irrespective of the profession they happen to be in. And for a diseased person, of course, it is the doctor's prerogative to understand whether it should be once in 6 months or once in a year, etc., depending upon the kind of disease state that they happen to be in.
Is it sort of
Now,
applicable? Sorry to interrupt you, doctor. Is it sort of applicable for children as well?
definitely, especially in children who do have illnesses, and those who have is about 8 years or more. It is good to have them in a treatment program for 7 days or 10 days. And of course, it all depends upon how much they can endure. It's not that every kriya or every procedure in the Panchakarma, be it the induced purging, be it the induced emesis, be it the enemas, etc., needs to be done on everyone. It is a physician who has to decide for this particular illness or for this particular body constitution of a person, which among the five is the most um, uh, effective and which can be done, because all these procedures do have their indications and contraindications. It is not something which can be done on everyone. So these are some information which most people do not know. When they come for a panchakarma, they believe that they are entitled to have all the five cleansing procedures, but it is a duty of the physician to ensure which is the best for them.
Understood. Understood. Uh,
Mm.
Doctor, coming to the medicational part of Ayurveda, most often you are given medicines which are quite bitter, right? It's quite very difficult to consume some of these medicines. So what does these medicines really contain? Is it metals or minerals? What, what, what makes it a little difficult, from a medicinal constitution perspective to consume these medicines?
Ajesh, the questions you asked, the last question which you asked, especially regarding the oral medications, is something which most people do have in their minds whenever they are directed to an Ayurvedic physician or an Ayurvedic treatment center. And I don't blame them, because there is so much noise created about having heavy metals in Ayurvedic medicines. But it's not true that every Ayurvedic medicine is toxic. Uh, Strictly speaking, Ayurvedic medicines can be categorized into three: medicines which have the ingredients purely from natural origin, plants and animals; medicines which are having ingredients originating from ores, metals and minerals; and medicines which have ingredients from both, means both from natural sources like plants and animals, as well as from metals and minerals. Now, even certain herbs are toxic in their natural state. So they have to undergo a elaborate purification procedure to be made biocompatible, and only then to be used as an ingredient in a recipe. The same goes with the metals and minerals. But if you ask me, metals and minerals are about twice or thrice as potent as herbs, but they contain more toxic chemicals in it, which needs to be removed with the purification process. So the whole process of ensuring the Ayurvedic medicines, whether it is plant-based or metal-based or mineral-based, has to go through a elaborate standardization and regulatory process, which is ensured by the Drug Control of India and the Institute of Good Manufacturing Practice in India, the IGMPI. And these ensure that every medicine that is manufactured in India comes with the license and they undergo the purification process. But this is not known to many. From a physician's perspective, I would always require or request my patient rather to buy medicines only if they have a label, and if that label shows the ingredients of the in that medicine and the license which has been granted to the manufacturer of that medicine.
Yes, right. Brilliant, doctor. I think it was a wonderful session and a very enlightening one, especially for me. I hope it's the same for all our viewers as well. Uh, uh, just to remind all the viewers, Jyotish for All is the only astrology platform with Ayurvedic doctors consulting within the platform. Very useful for people who stay abroad, who's not able to access Ayurveda in a country like US or Canada or UK, where Ayurvedic practices are very minimal. You just use the Jyotish for All app, click on the call button, use the internet, and you are able to talk to a doctor and seek the right guidance from them. Medicines can be shipped across. Reach out to Dr. Manmohan for any questions, queries. You should definitely be able to take a great consultation with him on Jyotish for All. Thank you once again for being with us. We will be back yet another. We'll be back with yet another episode. Until then, thank you, Dr. Manmohan, for enlightening us, and thank you for being with us on the show.
Thank you, Ajish, for giving me an opportunity to be with the platform. And I'm quite sure that there are a lot of questions that are still left unanswered in the minds of people, as well as those who are using the app. There would be individual questions regarding their health concerns. I'm available whenever that you want me to, because I have specific timings for consultations from across different time zones. So please check the availability, and then I'm all there for you to help you out of your concerns. Thank you so much, Ajish.
Thank you so much for joining us, Dr. Manmohan. Thank you. And see you, viewers. We'll be back with a new episode with Dr. Manmohan very soon. Thank you.